So, have you ever stopped and wondered about this? Why is one medicine a pill you swallow, while another is a patch you stick on your arm, or even an injection? Well, it's definitely not random. Actually, it's this really fascinating delivery puzzle. And in this explainer, that's exactly what we're going to do. We're going to piece together how medicine actually gets where it needs to go.
Right? So why is there a difference? I mean, wouldn't it be so much easier if everything was just a simple pill? Well, the answer, it's actually one of the smartest strategies in all of modern medicine. It's all about figuring out how to navigate the incredibly complex landscape that is the human body.
All right, let's really get into this. I want you to think of it like a super high-stakes delivery puzzle. The goal sounds simple enough, right? Get the medicine's active ingredient from point A, the pill or patch, to point B, the exact spot in your body that needs help. But doing that efficiently? Yeah, that's where it gets really tricky.
And this is maybe the most important thing to get right off the bat. This has almost nothing to do with convenience. Seriously, the choice between a pill, a patch, or an injection, it's a carefully calculated strategic move. The whole game is about getting the maximum effect from the drug, while at the same time trying to keep any side effects to an absolute minimum.
Okay, so let's start with the one we all know best. We can call it the digestive highway. This is the main road for most medicines, and, for some really good reasons. This is the oral route. You might see it written as PO on a medical chart, which just stands for per os, or by mouth. And yeah, it's exactly what you think. You swallow a pill, and its journey begins. It's the go-to method for a reason. It's usually the easiest and safest way to take something, which makes it perfect for treatments that you have to take for a long time.
But, and this is a big but, this journey is no walk in the park. I mean, after you swallow it, that little pill has to survive the brutal, super acidic environment of your stomach. Only then can it get to the intestines, which is where the real action happens, getting absorbed into your bloodstream. So yeah, it's an effective route for sure, but with all these hurdles, it can be slow and honestly, sometimes a little unpredictable.
Okay, now this is where things get really, really clever. What if you can't wait? What if you need to completely bypass that long, winding digestive highway? Well, you take a shortcut. You know those little tablets you put under your tongue? That's called the sublingual route. It dissolves right there and gets absorbed directly into all those blood vessels. It completely skips the stomach, skips the liver, and the result? A way, way faster effect.
And there's actually another cool trick for the mouth. It's called the buccal route. That's when you place a medicine between your cheek and your gum. Like the sublingual route, it also avoids the stomach. But what's really great about this method is that it's designed for meds that need to be absorbed slowly and steadily over time. It gives you a much more sustained release.
Okay, but what happens when that digestive highway is just too slow? Or even worse, what if the stomach acid would just destroy the medicine? Well, in that case, you can't take the scenic route. You need an express lane.
And that's the perfect analogy for our next set of routes, injections. Think about it. If a drug is going to get destroyed by your stomach, or if you're in an emergency and need something to work right now, you can't mess around waiting for digestion. You've got to get that medicine directly into the system, and fast.
So this chart kind of breaks down the three main express lanes. First up, you've got intravenous, or IV. This is the fastest of the fast. It goes straight into a vein for an immediate effect. It gives doctors total, precise control over the dose. You see this all the time in emergency situations. Then there's intramuscular, or IM. That's an injection deep into a muscle, like a lot of vaccines are. It's a bit slower than IV, but still pretty quick. And finally, there's subcutaneous, or SC. This one goes into the fatty tissue just under your skin. Now, it's the slowest of the three, but as you're about to see, sometimes slow is exactly what you need.
And that leads to a really interesting question, right? Why on earth would you ever want a slower injection? Well, think about something like diabetes, where you need insulin. You don't want a massive, sudden rush of it hitting your system all at once. A subcutaneous injection gives you that slow, steady, sustained release of medicine. It's beautiful, really. It mimics the way your body would naturally release a hormone. Another super fast express lane? Inhalation. Just think about this for a second. The surface area of your lungs is enormous. We're talking about the size of a tennis court, and it's just packed with blood vessels. That makes it an unbelievably fast gateway into the bloodstream. It's exactly why asthma inhalers work so incredibly well. They get the medicine right to the source of the problem for pretty much instant relief. So, up to now, we've been talking about getting medicine into your whole system, right? Systemic effects. But what if the problem is just in one tiny spot? Sometimes you don't need to send a memo to the entire body. You just need pinpoint accuracy.
And the logic here is just common sense, really. Why send an email to the whole company when you only need to talk to one person? That is the power of local treatments. They're designed to work on one specific area of the body, and that's it. This is amazing for cutting down on side effects and just focusing all the medicine's power right where you need it.
Okay, this next one clears up something that I think a lot of people get confused about. Let's say you have a cream for a skin rash. That's a topical treatment. It's meant to work locally, right on the surface of the skin. But a transdermal patch, like a nicotine patch or a pain patch, that's a whole different ballgame. It's using your skin as a doorway to slowly release a drug into your entire bloodstream. So one is local, the other is systemic, and that is a huge, crucial difference. And the list of these kinds of special deliveries just keeps going. You've got ophthalmic, that's just eye drops, for treating the eye directly. Otic drops go into the ear canal. Nasal sprays can work right there in your nose, or they can be absorbed for a really quick systemic effect. And then you have other routes like rectal or vaginal. These are often for local treatments, or they're used when the oral route just isn't going to work, maybe because someone is sick or unconscious.
Okay, so we've looked at all these different highways and shortcuts and express lanes, so what's the big picture here? What's the main takeaway from all this?
You know, it really boils down to this one simple idea. The form your medicine comes in is never an accident. It is always a deliberate, strategic choice. It's this careful balancing act between the drug itself, how fast you need it to work, and the specific target in your body. When you think about it, it's kind of like a quiet masterpiece of biological engineering.
So next time you take a pill or put on a patch or see someone with an IV drip, just take a second to think about the incredible, strategic journey that medicine is about to go on. Your body is the landscape, the map, and medical science is always, always looking for smarter, better routes. And that really makes you wonder, doesn't it? I mean, with stuff like nanotechnology and targeted gene therapies just around the corner, what will the delivery routes of the future even look like?